with Colleen Zuntag, our herbal medicine expert that's coming on here, and we're really excited to have her back. So welcome back, Colleen.
Thank you.
And see, Christine is on here, so got your tribe here. Welcome, everyone. Thanks for coming in again and spending time with us today. Just wait, I'll wait a minute or so, I think, here as people come in. And what was I going to say this morning? Yeah, I'm reading this book actually as people kind of come in called Regenerate. Have you read that, Colleen? It's by Sayer G, greenmedinfo.com.
No.
It talks about how plants especially can go above the gene and they can go into the cell and they can form the cell and they can talk to the cell independent of the gene, which is interesting. So basically over the billions of years of evolution, the plants have found a way to communicate with the animal kingdom.
I love that. It's called Regenerate.
Regenerate. Yeah, we're doing that on the CIH community page. We're having a little discussion about it, but it's a really good read. So if anyone is interested in that, please pick that up on Amazon or something.
Thank you for sharing.
Yeah. So we'll first start with the clinic. Welcome everyone, and for those who've just come in, Colleen is our herbal medicine expert here. That is part of I think. You have a herbal practice and we're on the first time with us, and we're here again with Colleen, so welcome back. Talk about herbal medicine and how that can really help your health. So I want to talk about, as we kind of all talk about coronavirus again, we're going to talk a little bit about it. Cases are holding steady in Maryland. Unfortunately, nationally, it's climbed about 179,000 deaths, but there are different components to immunity, and we're just talking about how plant medicine can really inform our cell health independent of genes, which is interesting. But there's different components of immunity, including natural killer cells and B cells and T cells, and prior exposure to past common cold coronaviruses may actually be protective against the current coronavirus in up to 50% of people, based on an article that was published in Nature that was done in Singapore. So we do recommend here, and I do want to focus a little bit on this today, on optimizing immunity. So we're not recommending that if you're not symptomatic and you don't have exposure to get tested. But if you are symptomatic or you're asymptomatic, but you've had exposure, we would still consider directing you to an urgent care clinic or to a CVS clinic type of place for nasal swab testing. However, this week, the CDC, the Centers for Disease Control, actually came up with a statement that's somewhat controversial on contact tracing. They basically said that if someone was exposed and was at high risk of catching COVID, but was not symptomatic, to not test. So that was a reversal of kind of the whole idea of contact tracing. So I'd be interested to hear what people have to say, what you think of that here on the webinar. Just kind of type in the chat box. I think it's still, we have to look at it from an individual perspective, but from definitely a social, society or a commonwealth type of perspective, we have to look at, it's not only about us, but it's about our own fellow humans or fellow neighbors. So, I would still say that would be a consideration if you really did get exposed to potentially get tested, or at least to talk to your practitioner about that. Just ate some lunch, so I'm washing down my lunch here. So coronavirus vaccine information, there are early stage trials of the Moderna vaccine, and 20 volunteers ages 56 and up actually did have neutralizing antibodies and T cells. So it seems like it worked in that group. That was a 2-shot one and then a booster. That's an early stage, and then they're going to do a final round phase 3 trial, which they hope to have results by October. Whether or not that's ready for prime time and will be safe and effective, it's hard to say, but they are kind of operating pretty quickly there. Worldwide, there's actually over 150 vaccines being developed, and 31 of those are in clinical trials. That was not what I wanted to do. Flu vaccine information. So we do have the flu vaccine here in a couple weeks in early September. You can contact Jennifer Thomas. We do feel like vaccines are part of the picture for immune health, but not the whole picture. We do have a mercury-free flu vaccine, and it's egg-free and also preservative-free as well. But we do recommend to optimize sleep. We do recommend to optimize the gut microbiome and support immune system activity as part of what we call integrated vaccine protocol. If you do decide to get a vaccine, you can do mushrooms, you can do IV macronutrients, including vitamin C, glutathione, within 3 days before or after a flu vaccine. Probably before is better, actually, in order to support your immune system. And we're going to talk about today about how plants really inform that. And so let's talk about this, because I think this is kind of an interesting slide. If you look at this person walking towards the light, how are we going to get back to normalcy? And this is actually getting on to almost 6 months of this now. And so, there's different pathways to put normalcy, which are not mutually exclusive, but there's possible vaccines out there. There are 180 companies working on that. There's social distancing, which I still think can be very helpful. And we know that that's flattened the curve a bit. We know that there's potentially time that just as the virus either mutates and becomes less infectious or less deadly potentially, or its herd immunity was estimated at 20 to 60%, depending on the study. Time may also kind of have the virus die out a bit. But what we really want to focus on, what we have more control over potentially, is boosting our own immune system. That's where plant medicine and herbal medicine really shines and comes in. So I think we're going to think about immune, health and pathways to normalcy in different ways as we move forward. And I'd love to hear what people have to say about that. Saliva tests like Volt, I think it can be helpful for people that want to know if they're infectious or not. Yes, I think that's vaulthealth.com. It's $150. That's an interesting. Thanks, Margaret, for the. Margaret was saying that potentially it's a political thing where just kind of reducing the CDC recommendations just to reduce testing but it's not addressing the spread of infections, and that may be true. It's hard to say for sure, but certainly it's hard to disengage from that right now. And then Paul is going to ask this, and maybe Colleen, you can answer this later when I hand that over to you. But he was asking about sea moss and how is that a helpful herbal supplement for men? So thank you for asking that, Paul. I think, so, nature is waiting. We are actually part of nature. We are nature. So it's my belief, and I think, everyone on here's belief, that the closer we are to nature and the more aligned we are with nature, kind of like, sitting in this park here, that would be more in line with nature, grounding, kind of, the fresh air and sunlight and looking at the trees and touching the plants. Nature is waiting for us, and that's going to be really helpful to restore our immune system. So we have a few other announcements, and then I'll turn it over to Colleen here. Here's our September schedule for the wellness webinars on Thursdays at 12 to 1, which is right now. So next Thursday, we have Elizabeth Reese, who's a practitioner here at CIH doing heart math, which is a type of biofeedback that balances the heart and brain and really can help with autonomic nervous system balance, to help with chronic stress, anxiety, depression. Not a substitute for therapy per se, but and used in conjunction with many other things that we can do here, but very helpful, I think, in a lot of time of chronic stress like right now and in moving forward. And then on Thursday, September 10th, we have Jay Gill, who is a integrative pharmacist. So we'll talk about some of the compounds that he uses, that he specializes in, that can really help people move their health and wellness to the next level. And then we have our own Araceli Benavides in 3 weeks from now, and she is going to talk about red light therapy with me, and we'll talk about the benefits of that in relation to optimizing the mitochondria, energy, opening your circulation, and much more. And then on Thursday, September 24th, we have Dr. Carrie Jones, a naturopathic doctor who is an expert on hormones, a nationally known expert on hormones. And we're going to do a hormone Q&A. We're talking about adrenals and thyroid and sex hormones, any kind of hormones you want to talk about, you can ask Dr. Jones about. So really excited about all of those. And really, and then one other thing is that we do have some group classes coming up that are going to be virtual group visits. You can ask Wendell about or message him through the portal, and he can register for you. I'll be doing these on, one is on optimizing immune health. Some of you have already done one of that, but it is going to be updated a bit, and that's Tuesday, September 8th at 4 p.m. And the other is on optimizing sleep. Optimizing sleep doesn't mean to turn on your cell phone more and do that and read about sleep on your cell phone, but it is about, lifestyle and nutrition and many other kind of integrated and functional ways to optimize sleep. That's Tuesday, September 15th at 4 also. So look forward to seeing some of you there. And then now on to Colleen. So welcome again, Colleen, and really excited for round 2 of this.
Thank you, Dr. Wong. I'm so excited to be here. Thank you for having me. Last time we did this, we did kind of a rapid fire question and answer, and it was a lot of fun, but I thought this time I'd do a little bit of a presentation and do question and answer after, so we have a little bit of something to start the conversation with, supporting immune health and stress response during this time, this historic time in the world right now. We talk a lot about stress. I mean, it's a big part of our everyday conversation. But I don't really feel like we, as everyday people, we realize the effects it has on our biology as we're trying to live in this world. Our body is always working to move towards homeostasis and balance. And when we're constantly in this influence of sustained and chronic and acute stressors that come along the way, our body loses that ability to effectively turn on their stress response in a healthy way and then turn it off so we can move from parasympathetic to sympathetic nervous system in a more graceful, rhythmical way. And so we end up staying more in that sympathetic nervous system mode where we're constantly bathing in that sea of stress hormones in our body. So what can we do about that? Herbs can come help, and they're great partners to work with us as we're managing stress. And let's talk about some of those herbs.
Colleen, would you mind making it in the presentation mode, making it a
Sure.
little bigger?
Let's see.
I think you can just do the present from current slide on that same menu.
Let's see. How about that?
Yep, that works.
Thanks, Jen. Okay. So immune support, we talk about immune support, and Dr. Wong talked a little bit about this. And today I'm going to focus on herbs, a little bit of nourishment, and rest, movement, and self-care are topics that we can do another time. And it sounds like Dr. Wong has a bunch of those speakers coming up to go more detail about those topics. So I'll stick mostly to herbs tonight, and we'll just move from there. This is an image of Schisandra chinensis. This is an adaptogenic herb from China, 5 flavors. It's great for anxiety and managing the stress response. So the first thing we can think about doing is nourishing our body. So our body has the nutrients it needs to respond to the stressors. If we're chronically deficient in nutrients, our body is not as effective at responding to stress. And the catch-22 of that is that the body gets more and more nutritionally deficient the more stress we're under. So it's super important to focus on nutrient-dense foods. And as Michael Pollan says, eat real food, mostly plants, and not too much. And I threw the real in there because we have to define what is really food. It's a very simple philosophy, and I think we can get complicated sometimes when we think about what is nutrition, what's healthy. There's all kinds of fad diets going on. I think the simplistic way to look at it is look for real food that's nutrient dense, mostly plants, and then don't overeat. And the way herbs can support that is we can work with deeply nourishing herbs and make them part of our life on a weekly or daily basis. And here we have some of those herbs, and I'll go into a little bit detail on some of these. We have red clover in the top left corner, borage, the one that looks like a star that's so precious. In the bottom left is oat, and then we have some marshmallow. So let's go into a little bit of detail about some of these nourishing herbs. This first slide is Urtica dioica, also called stinging nettle, and it's a common weed found in woodland forests. It grows all around the world in temperate climates. I think it's also in the tropical areas also. We can see it here in flower. The flowers are really tiny. But stinging nettle is Western Herbal's super nutrient dense herb. It's full of calcium, magnesium, phosphorus, all these deep minerals. It has omega-3 fatty acids, protein, vitamins A, zinc. You can see the list here. We use the leaf in herbal medicine as a tea or an infusion. As a vegetable, you can pick it. This early emergent leaves in the spring are a great vegetable. You have to wear gloves though, because it does sting. You can steam it and use it just like spinach. I make nettle pesto with it in the springtime, and you can also use it in capsules freeze-dried. It's great for chronic allergies to use it in a capsule form as a freeze-dried extract. We also use the seeds. The seeds are mostly used as deeply nourishing for the kidneys. I've used them with people who have chronic kidney insufficiency. Use it as a tincture. You can also use it as a food. My plants are actually in seed right now, so I'll be harvesting them the next few days, and you can sprinkle it on salad, It's really, I've never seen it sold in stores or online, but you can check Frontier Herbs or Mountain Rose Herbs, they might have it. And the root we use is mostly for men's health. We use it for BPH in a tincture, or you can use it dried. And you can use it actually just, I'm sure most people have heard of golden milk where you use turmeric, but you can actually use nettle root for that also. It's a deeply nourishing for the genitourinary tract, specifically for men. And this is what the stem looks like. And you can see those little needles on there, and they have formic acid in them. And the natives in North America used to self-flagellate. If someone had arthritis, they would take the nettle plant and they would whip it on the arthritic area of their body, which would create an immune healing response and relieve, increase circulation. It's a rubefacin, and it brings the blood to the surface and increases circulation to reduce inflammation and inflammatory metabolites as an external treatment. But it's much more easy to use if you drink it internally. It's a blood nourishing tonic, super nutrient dense. It's considered an alterative. An alterative is a word we use in herbal medicine for plants that help the eliminatory organs. So they help remove, like I said, inflammatory metabolites in the body. So the eliminatory organs can be more efficient, but then also we can uptake nutrition more effectively. It's an expectorant. It's great for lung support, anti-inflammatory, anti-allergenic, a mild diuretic, and a mild astringent. The next plant we're going to talk about is red clover, Trifolium praetens. This is that common weed you see on the side of the road. I've seen it in a lot of median areas on the, as I'm getting off and on the beltway. It's a humble little plant, but it's super nutrient dense, packed with isoflavones, calcium, magnesium, B vitamins. It does have coumarins in it, so you would need to work with your doctor if you are on blood thinners. But it's very, very low dose. And if you get your INR tested regularly, you just would slowly bring this plant into your diet if you're drawn to taking it. We use the flower heads. You can actually eat them raw. They taste delicious, and put them in salad. You can make a tea or take it as a capsule or tincture. And we use red clover internally and externally. It's great for chronic skin conditions. It is an alterative also. You can use it in the bath. Specifically very calming and soothing for children in the bath. It's a little too mild for adults, I think, in the bath. You can use something more like kava kava in the bath for an adult, but red clover is great for children in the bath. So it's a blood and lymph alterative, like I mentioned before. It's specific, it has an affinity for the lymphatic system, which will help the immune system. The lymphatic system helps remove waste from the body and bring nutrients to the body, but it also is a huge part of our immune system. So red clover is really wonderful that. And historically it has been used in cancer treatment, but that's super high doses and under care of a skilled practitioner. It's also a nervine, meaning it helps calm and relax the body. It offers hormonal support, like I spoke about the isoflavones. Great for skin support. Again, the lymphatic system is really connected to the skin. So if you have issues with your skin, if you have psoriasis or eczema, red clover is wonderful for that. Nourishing, and it's expectorant, antispasmodic, and a tonic. It's something you can drink every day. And we have Avena sativa, common oats. I mean, most people grew up eating oats, and if you get the whole oats and soak them overnight, they're really nutrient dense also. I keep saying that word. Chromium and iron. It has saponins in it, which are anti-inflammatory. We use the milky oat tops for medicine in herbal medicine as opposed to the grain. We eat the grain, but we use the milky oat tops and the oat straw for medicine in herbalism. So the milky oat tops are super great for people who've been chronically depleted. They're maybe a dry person who's deficient and they've been under stress for a super long time. Milky oat tops are wonderful. You would need to start with higher doses in the beginning, and then you can taper off later. It's very, very mild. And we use a fresh tincture of the milky oat top. You can also use it as a tea. It's very effective, but you want to make sure it's as freshly dried as possible. And they do have extracts also. I believe Gaia Herbs might have an extract of it. And the oat straw also is nutrient dense. It's really good for people, again, like I said, have been chronically depleted. It's cooling and nourishing. It also can be used in a bath, specifically for dry skin conditions. So it's a nervine tonic antidepressant. It is uplifting. It helps mood stabilize, specifically through perimenopause and menopause. Also, it'd be good for children. It's definitely gentle for children who are feeling the stress of their environment. Also, you can make an oat straw or an oat top infusion for them. And like I said, it's nutritive, demulcent, meaning it's soothing and moistening to dry tissue, and a vulnerary, which means it's a wound healer. So I put a recipe in here for nourishing herbal infusions because most of us when we take a cup of tea, we just take a teaspoon of tea and put it in 8 ounces of water, or 10 or 12, depending how big your coffee mug is or your teacup is. Pour boiling water over it, and we drink that as a tea. And that's nice for a delicious cup of tea, but that's not a medicinal dose of tea. So if you really want to get the nutrients out of these herbs, specifically the minerals, it needs to be a higher herb to water ratio, and it needs to be infused for a longer period of time. So a nourishing herbal infusion, I put just a general recipe here, 1 ounce, which is a lot of herb, especially if you look at red clover. It's a very fluffy herb. Stinging nettle leaf, red clover, or oat. You can use this with other herbs also, but we're just focusing on these 3 today. Put 1 to 1.5 liters of boiling water. I'm a little liberal with the water, especially when it's red clover, because red clover is so fluffy. You need to make sure you have enough water to cover the plant and allow the plant to sit in there completely. And then you can, to the nettle can, if you take nettle for a long period of time, it can be very drying. So it's important to add demulcent herbs or those moistening herbs like marshmallow root, or a little bit of licorice root if you can tolerate the taste. Fennel also would work, or you can put some chickweed in there if you have some fresh chickweed. Those herbs can work wonderful also. And then the supplies you need are listed there also, and you place the herbs in a heat-proof 2-liter container. Pour the water over the herbs, cover, and allow it to steep at least 6 hours overnight. Overnight's preferable. You stir it every couple of hours while you're awake. You don't have to get up and stir it, and then strain it and drink 2 to 3 cups per day. And if you're going to do something like this and really experiment with these plants and get to know these plants, I recommend you do it for a long period of time, and pay attention and observe to any changes you might be experiencing in your body. If you take the nettle leaf, the owner of Smile, Tom, always says, Sister Nettle gives you courage. And if you see the stinging parts on the nettle leaf and the stem, that plant needs that to help it have courage. And it also gives us courage. It infuses that medicine into us, that courage. And so you can journal while you're taking these herbs and see how is this changing my existence? How is my changing my response to stress? Oat straw in particular, or milky oat tops. You can take that, I would at least 3 weeks, any of these, at least 3 weeks, have a relationship with these plants. And just observe, how is this supporting me? And what am I feeling? And how am I shifting? Am I going back to my homeostasis state of mind, where I'm not flaring up? Sometimes women in menopause and perimenopause, the hormones are changing so much. It can also happen after you've off the birth control pill, or if you've had children or you're weaning, your hormones are fluctuating so much, and you might not feel like yourself. And these deeply nourishing infusions can help support you during those changes. Also, during stressful times, we don't always have time to cook nourishing foods, even if we keep it simple. The idea of cooking and cleaning the dishes and going to the grocery store can be really overwhelming. So these nourishing infusions are so simple to make, take little equipment and time, but they pack a punch when it comes to giving us nutrients that we need to support our nervous system and our stress response. So I really encourage you to try working with these plants in this way. Other considerations for deep nourishment, seaweed. A gentleman had mentioned sea moss. Yes, sea moss is really deeply nutrient rich. I don't think it has an active effect on the immune system. If we think of something like echinacea or reishi, or even astragalus, we're seeing signs that studies are showing astragalus has active effects on the immune system. But sea moss, which is the same as Irish moss, Chondrus crispus, is full of nutrients. And so that helps the body respond to stress more efficiently. So yes, I think sea moss and Irish moss are wonderful herbs to take in. You do have to watch if you have a sensitivity to iodine or hyperthyroid. to go slowly and really monitor those herbs, because these nutrient-dense herbs or foods separate from the nettle and the oat and the red clover, but the seaweeds, chlorella, some of these can be very effective at really, really low doses. So I would start low with the sea moss and the seaweeds, you know, just an ounce a week, which is like a teaspoon. I mean, or let me say 3 grams a week, about a teaspoon of the herbs for the week. You can put it in your beans or lentils if you're cooking them, put it in a salad and vegetables, but start slow. And healthy fats, of course. Healthy fats are really supportive of healthy inflammatory response, specifically for the nervous system too. So healthy fats like avocado, coconut, cod liver oil. My great grandma would be really happy that I'm using cod liver oil and recommending that. But these old traditions really still ring true today. Let's see, Irish sea moss in low doses. So you, Smile has it in bulk sometimes, so you could call them Smile Herb Shop. They're in College Park. So you can call them and get a small amount. They sell it by the ½ ounce, I believe. And that's a good place to start. Okay, let's see. Okay, so the adaptogens is a word that's also been thrown around a lot. There's been a lot of marketing about adaptogens, and they are very effective and supportive for the immune response, but they're not a panacea. Yes, Monica, Frontier Co-op. I don't think you can get small doses of Irish sea moss there. I think or small amounts. I think you have to buy it by the ounce. I'm not sure, you can check, but they usually don't sell like ½ ounce or ¼ ounce sizes. But the role of adaptogens, well, first of all, what is an adaptogen? We talk, I don't know if you guys have that in your community, but of course I'm an herbalist and I'm around it a lot, hear people talking about it. But there are 3 qualifications to make an herb an adaptogen. And the first one is it's non-toxic in normal therapeutic doses. It produces a non-specific state of resistance to stress, allows the body to more effectively resist a range of stressors, like, you know, life challenges, illness, injury. All those things are stressors on the body, and adaptogens help the body have a more effective resistance to them. And it also, the third qualification, it has a normalizing influence on physiology. So they're non-specific. They don't always, they definitely have an affinity for certain organs and organ systems in the body, but in general, they have a non-specific effect over the total body. And those are the 3 qualifications to make an herb an adaptogen. So this is how do they support the immune system? Well, they support the immune system by working with the endocrine system, the immune system, and the nervous system to manage our response to stress. And some of them have actual immune stimulating and modulating effects on the body. So 3 ways. So you can read here, they improve immunity, especially B cell, macrophages, and natural killer cells, and then overall immune competence. They soothe the central nervous system via the HPA axis, which is our stress response, the hypothalamus, pituitary, and adrenal axis. They help relieve depression and anxiety, improve stamina via mitochondrial function, and inhibiting inflammation, so our cells can work more efficiently with energy exchange. Reduce insulin resistance, support healthy gut function, and healthy gut production of serotonin, and immune enhancement. So here are a list of some adaptogens, and I've loosely put these in these categories. I really don't like putting herbs in categories, but we do have to have a common place to speak from. But just know that when herbs are put in a category like this, that herbs are full of multiple chemicals and multiple actions within the same herb, and they don't fit nicely into neat little boxes. And that's the magic and the power of herbs. They're not one chemical component that's isolated. It's a whole plant, and that's where they work synergistically. All those chemicals work synergistically together. I mean, tests have been done to pull out active constituents of like hawthorn. I don't have that listed here. Hawthorn's more of an organ tonic. So they say, oh, this chemical is the active constituent in hawthorn that's helping lower the blood pressure or helping it be a safe tonic for the heart. And they test it and try that chemical component, and it does not work. But that chemical component works synergistically with all the other chemicals and active ingredients and inactive ingredients, in that plant. So please keep that in mind when you see plants like this, like I've done here, put them in categories, that this isn't a rigid black or white state. Shatavari also is calming. Rhodiola also can be, it actually is very stimulating. It's good support for the hypothyroid. Eleuthero, we might say it's immune stimulating because it's effective. Studies have shown it's effective for people who are going chemotherapy and their white blood cells going low. But eleuthero is also very calming for the nervous system. So just keep that in mind as I have these listed in here. These are just generalizations, and these herbs can work in multiple facets. So what is an immune modulator? We also call those amphoterics in the herbal world. It's an herb that actually doesn't stimulate or suppress the immune system. And when we're formulating as an herbalist, when I'm formulating for a client, I think of what actions do I want the herb to have for the person's system, but I also think about who is this person that I'm supporting or I'm asking the plants to support. Are they a dry person? Are they a more damp, wet person? Are they excessive? Are they deficient? Are they really tense, or are they really relaxed? Is their tissue really relaxed and they need more toning? And I choose herbs based on the actions and based on who that person is, what their energetics are. And so it's kind of an art and a science to formulate herbal medicine for a person. You don't want to formulate it for the disease or the illness or the health challenge they have. Sure, can herbs work that way? They can, but more effectively if you formulate for the person. And if you try to formulate for the disease, you will get stuck. It'll only work for a short period of time. You're missing the whole other components of the plant to work with that person. And so you can actually cause harm, make a person too dry, make them too wet, make them too stimulated. I've seen that in my own body. I have hypo and hyperthyroid. I really have to watch the stimulating things I bring in my body. So it's really important to know who the person is. So I've listed some of these herbs here, and let's see what time it is. Okay, I want to make sure I have time for questions. Anybody has questions? And so what else can help us help our stress response so we can keep our immune system healthy? And we have another category of herbs we call nervines or nervines. And I've listed some here: common chamomile, Roman, or German. They're both very effective nervines that help the body be calm, and it can help reset that stress response we have, so we're not overreactive to stress, to bring us back into balance so we have a more healthy response to stress, which will support healthy immune function. Skullcap, and this is Scutellaria lateriflora. There's also a Chinese skullcap. So the skullcap I'm talking about here is Scutellaria lateriflora as a nervine. Passion flower, blue vervain, lemon balm, damiana, catnip, and linden. Let's see, I have a question here. Let's see. Circular tea to work excellent for my cold hands and feet. I don't know what circular tea is. Oh, it has ginkgo and cayenne. Yes, that's great. No more cold symptoms. That's wonderful. They're very hot. Well, cayenne's very hot and stimulating, and ginkgo is a circulatory stimulant. That's wonderful. I'm so glad that you're getting relief. Okay. So the other thing I think of when I think of immune health is to support your personal vulnerabilities. And what I mean about that is we all, as we've lived in our bodies for a long period of time, we might have a chronic condition that we kind of just learn to live with, that we don't give enough attention to help resolve it. One of those things could be like a chronic UTI. It's irritating and you just deal with it, go get antibiotics, or try to drink cranberry juice and manage it that way. Or you might have a tooth infection that it's bad sometimes, it's not bad all the time, you kind of ignore it. Or you get chronic sinus infections that haven't really resolved. Those things are super important to resolve to support immune stress, especially when we're going into cold and flu season. So if you have a chronic tooth infection, you have a gum infection, get that taken care of and really focus on those things. If it's a low-grade infection that's been going on for a long time, your immune system needs support. And so your immune system will already be challenged if you go into cold and flu season because you have this chronic low-grade infection going on. And now you're going into cold and flu season, the weather's changing, your diet's going to change, and there are going to be different stressors on your body, right? Because there's so many different things that can be stressors. It's not just work or driving on the beltway. It's a chronic low-grade infection. That's a stressor on the immune system. It's when you injure yourself, if you have a chronic injury, that's a stressor on your immune system and your nervous system. So those things are really important to get taken care of. You can get body work. There's all kinds of things you can do to take care of those things. We'll talk a little bit about some of those here in a minute. So here's some system-specific support. As I've said, it's important to formulate for the person and not for the illness. And having said that, there are certain tonics that we can take on a regular basis to help support. Maybe we have a vulnerability or a constitutional weakness that we want extra support for. Maybe we're just older, we need support for the heart. And what can we take safely on a daily basis to help nourish our heart as we age? Because aging is a stressor also. We don't have as much, there's a lot of oxidative stress in the body. So how can we support that? And so for the heart, the herbs I've chosen for you to consider working with are hawthorn and yarrow. And yarrow is a plant that can work across all systems, one of my favorite plants, but it's also really good for the cardiovascular system. And motherwort, especially if you're having palpitations or going through perimenopause or other hormonal changes, motherwort's great. Or grief. Motherwort and hawthorn are wonderful for grief, which is another stressor that can be happening if you've lost someone that you love or a pet, or lost a job, or even the loss of the children moving out of the house, or transitions, life transitions. Those can all be considered losses. And how do we support our physiology to go through those losses with some grace and strength? So we come out stronger physically, and we can use herbs, tonic herbs, or organ remedies, we call those, to help do that. The kidneys, I mentioned stinging nettle seed and cordyceps, which is an adaptogen, are wonderful for supporting kidney function. The kidneys use a lot of energy. In Chinese medicine, they're in one of the main parts where we store our Jing, our core vitality that we were born with. And so protecting the kidneys, especially as we age, is super important. So stinging nettle seed and cordyceps are two great herbs to do that. Lungs, if you have chronic lung issues, maybe you have COPD or you have a history of asthma, mullein leaf is a great tonic herb you can take on a regular basis to strengthen the lungs. You can also work with elecampane and astragalus, which is used to be categorized as an adaptogen. It's been moved kind of into a restorative tonic right now. There's a lot of research going on about astragalus right now. It's also been shown to help with HPV and herpes 1 and 2. Anyway, we can do that another time. But liver, so maybe you have fatty liver, or you have had to take a lot of pharmaceuticals in your life, and so you have some challenges with your liver. You want to strengthen that organ. Milk thistle is a wonderful hepatoprotective herb. And across the board is generally safe for everybody. So it's very organ specific for liver and kidneys. Very nourishing. You can take it as a seed. They're really hard though. I like to soak them first. A tablespoon a day is really good, almost like flax seeds, but in a different way. They definitely have an affinity for the liver and kidneys. And burdock root is a really safe and effective food-like herb for the liver, an organ remedy herb. Male reproductive, nettle root, I talked about that, and saw palmetto, especially as you age. Female reproductive, the two main herbs I think of there are vitex and shatavari. Shatavari is an Ayurvedic herb. It's in the asparagus family. It translates to she who has 100 husbands. And it's a great female hormonal normalizer. Digestive system, chamomile is really safe pretty much across the board unless you have a severe allergy, which is pretty rare. But chamomile works wonders for a person who holds a lot of stress in their stomach. It's full of minerals also, so it can be great for somebody who has a lot of muscle tension also that goes along with that stomach tension. Chamomile can help relax the stomach so you can absorb those nutrients to make your body strong. And marshmallow, if you have GERD or acid reflux, marshmallow is a demulcent, so it's cool, it's soothing and moistening for inflamed tissue, specifically for the mucosal membranes. Blood sugar can really spike when you're under a lot of stress. So taking holy basil on a regular basis, and that was the first image I showed you all. Holy basil is the incomparable one in Ayurveda, a very revered herb in Ayurveda. It's great for managing blood sugar, but it also is an amazing adaptogen. I didn't talk about that because there's so many adaptogens to talk about, herbs to talk about. Holy basil is considered mahaguna, which means it has great qualities to open the heart and the mind. And it strengthens our our resolve. It's an amazing plant. Well, keeps us calm and soothe and manages our blood sugar. Fenugreek also is great for managing blood sugar. And the lymphatic system in the skin, I talked about red clover. Calendula is another amazing herb for the lymphatic system and skin. Some studies showing that it can help with some lymph cancers. But calendula is growing in my yard right now. It's such an amazing plant. You can make it in an oil. And it's good taking internally as a tea also. It's also a vulnerary, meaning it's a wound healer. If you have leaky gut, calendula is great to put in a tea formula as you remove the offenders that you're, the things that you're allergic to, the foods that you're intolerant to. Once you remove those offenders, then you can come in and bring the herbs in that have that healing quality to heal the gut lining so you don't have that leaky gut. And sinuses. I mean, especially now we're going into the cold and flu season, but chronically wearing the masks, which I do advocate wearing a mask. I don't want to give the wrong impression, but our sinuses are getting challenged by just constantly breathing in our own air. And if you have chronic sinus stuff, it's super important to take care of them. So goldenrod, eyebright, and elderflower, wonderful for the sinuses. Goldenrod also is for muscle pain. And it's for allergies. People often think in the fall they're allergic to goldenrod, which actually it's more ragweed that people are allergic to, but goldenrod happens to grow close to ragweed. Goldenrod is usually a remedy for people who have allergies to ragweed. I think I have a couple questions here. Let's see. I'm going to pause here for a minute. So about acne. So it depends on what is causing your acne. So first look at diet, and then you have to look at hormones, and then you can work at supporting the lymphatic system, work topically and internally. So Paul Anthony, it depends on what's causing the acne. But yes, herbs can help support acne. Detox from EMFs. I'm not sure about that, Dr. Wong. I've actually been really looking into that the last couple of weeks because I'm on the computer so much, and the phone, and having the Wi-Fi on and everything. So I will get back to you. I think the best way to protect ourselves from EMFs is to turn everything off and limit our time as much as we can and really be mindful about it. But I'm not sure about herbs. So Shatavari, if you're not having issues, it depends on who you are. Some people, in general, I would say yes, but watch yourself. I've taken it for long periods of time. I've taken it for a couple of years at a time, and it's been very beneficial. It's specifically female reproductive tonic. So it's in the asparagus family, like I said, it's demulcent. So if you are a person who's more damp and hold fluids, I would put it with a warming, drying herb like ginger. Then you could take it safer. But if you're a person that doesn't have that issue, then it's okay. So Shatavari, take 3 to 5 grams, up to 9 grams a day. I would start with the lower dose, 3 grams, which is about a teaspoon a day. And you can get it in powder. It tastes wonderful. Heat it up with coconut milk, a little bit of honey, some saffron or rose. It's just a beautiful plant. Any herbs for those oxidative stress? Yes, you need lots of herbs with antioxidants in them, polyphenols, all the deeply colored berries. Blueberry actually is one of the most nutrient dense common fruits we have. So I would just need to know a little bit more about what's going on with the oxidative stress. So hope that answers your question. You're welcome. So let's see. Sinus support. So we can talk about taking things internally. We can talk about managing our stress the best we can. But other things we can do to support our body are these practices that are Ayurvedic practices. They're for longevity and physical practice that we can support our body. Because some things we don't have any influence over, but we do have influence over what we can do in our body, like what we bring into our body. And we have influence over how we rest most of the time, unless you have a new baby or other things. But this is a great practice here for sinus support if you have chronic sinus issues. Oil pulling, where you put about a teaspoon to a tablespoon of sesame or coconut oil into your mouth, and you move it back and forth in your mouth, almost not like you're gargling, but like you're swishing it in your mouth. 10 minutes up to 20 minutes. You can start with 5 minutes. It actually does loosen chronic mucus that's in the upper palate in that area, in the sinus cavity area. It is very effective for people who have chronic mucus or catarrh that's building up in that upper respiratory system. It does strengthen the gums. I'm not sure it does all the miraculous things you read about on the internet. I don't think there's any proof of that, but it is a great daily practice if you're in the season where you're chronically challenged with your sinuses. Now, how do we do all these things when we don't have a lot of time? You don't. You can't do everything at once. You'll stress yourself out, and then your therapeutic remedies start causing you stress. And we definitely don't want the therapeutic remedies to cause stress. So just do them as you need it. So pick one thing you're going to work on. So maybe I'm going to practice self-massage, or maybe I'm going to practice my chronic weakness is my sinuses. So I'm going to try the oil pulling, and then afterwards I'm going to do the neti pot. Which is the little porcelain pot on the bottom right here. And you pour warm water that's been infused with a sea salt, or you can use herbs also to pour it through your nasal passages to clear that out. And then afterwards, after about 10 minutes, you can use an herbal infused oil, a couple of drops in each nostril. And those are, especially if it's the dry season, as we're going into the fall, it's going to be really dry. You don't want to just do the neti pot. A lot of people do these nasal rinses, but then you continually dry out your mucosal membrane, which causes inflammation and irritation, and then overproduction of mucus, and you start this cycle over and over again. So if you do the neti pot or do any kind of sinus rinses, make sure you use an oil, follow up with an herbal infused oil afterwards. Other self-care practices, sleep hygiene, and I think Dr. Wong talked about having somebody come in, is going to be on your Thriving Thursdays talking about sleep hygiene. But this is another area we have a lot of influence over in general. I understand if you have raising children or if you have babies, it's a little bit of a challenge, but our bodies really love rhythm and love a regular, I don't like to say structure or schedule, but I think a regular rhythm, because we are a reflection, we are part of nature, and our body does respond to these regular rhythms of, I'm going to turn off the electronics about an hour and a half before bed as much as you can, or limit them if you can, not just mindlessly watching TV because you need to check out because you're so stressed. You know, start cooling your body down, start changing your breathing patterns, and, you know, consciously move yourself from activity through the day to restful movements and practices as you're preparing for bed. Unplug, I talked about that, unplug from the computer, unplug from the phone, to protect your inner world, to keep your body inward more, which can help you have a self-awareness also about what is going on with my body, so you can catch things earlier rather than later. Spend time in nature. A lot of studies coming out showing how important it is to be in nature and away from the sounds and the busyness of life, and just be connected to our relatives outside. Abhyanga, I mentioned that a little bit. That is an Ayurvedic practice of self-massage that's very soothing and brings a rhythm to the nervous system and the lymphatic system. You can look it up online. There's videos. Banyan Botanical has a video online to show you how to do that. And a lot, you know, we do have immune function on our skin, and oiling our skin also feeds those microbes, those healthy microbes that live in our skin, so we can have a healthy skin environment. Slow down, I talked about that, but even simply slowing down between activities. So like, say you're moving from having dinner to washing the dishes. Mindfully, don't rush around to do that, because that can also slow down the nervous system. We keep pushing ourselves and going faster and faster, got to get this done, got to get that done. But taking these little pauses between activities can really build up over time to create this healthier response of the stress response in the body, which can support the immune system. And breath work. So pranayama is an Ayurvedic practice of breathing. There's lots of different methods to it, but pranayama is actually the state of mind you're in after you do the practices. So you might not, maybe you have an injury and you can't exercise, and you know, don't have time, or it's too hot outside. You can sit and do breath work. Breath work moves the diaphragm, which moves the lymphatic system. If we pump that diaphragm, it'll move the lymphatic system. It allows us to breathe deeper. It brings us back into that parasympathetic nervous system, that rest and digest, or feed and breathe mode, which can really manage our stress powerfully. And that's the main area I think we have influence over, is how we breathe. So I really encourage you to look into ways to use your breath for healing, to keep your immune system strong and your stress response strong, your endocrine and your nervous system, so your immune system can be strong. And there's some references there. Let's see. Have time for questions here. If anybody has any. Oh, we have some questions. Okay. Hold on just a minute. Okay. All right. Oh, good. I said, Dr. Wong says on the 15th of September from 4 to 5:30, optimizing sleep. That's going to be amazing. Try to tune into that. No thyroid,
It'd be
Matthias,
fun.
which is,
Yes.
yeah, it sounds like it. So I think they can help you. It depends on what challenges you're having. So there's more to the endocrine system than just the thyroid. So we can work on other ways to support the nervous system or the endocrine system with herbs. I have a client actually who's a thyroid cancer survivor also, and we have him on Googaloo, which is a long-term herb you would take. So we can talk, if you want to, we can talk about that another time. Oxalate levels. Yes, you have to watch oxalate. That's really important to do that. No, I don't know of any of those herbs except for yellow dock leaf might be high in oxalate levels, but we don't use the leaf. I believe the oxalates are mostly in the leaves, so maybe check out nettle. I don't believe it's high in oxalate levels though. Kathleen, that was for Kathleen. Any other questions?
I have a list of questions here.
Oh
no! There's always some at the end.
Okay.
As you're talking, this is great. Thank you so much again, Colleen.
You're welcome.
Yeah, so I don't know. These are somewhat general and possibly tangential, but I guess we'll start with food. So we know that plants are food. We know that food is medicine, right? So this herbal
Yes.
medicine, plant medicine, you know, really plants, as I was saying at the beginning for those that missed it, plants can actually, there's these microRNAs that get inside your cell and they can activate the cell independent of genes, independent of epigenetics even. So that's pretty amazing. So that there's a book that we're reading right now on the community page called Regenerate by Sayer G. Really recommend that. That's the book name. But basically, are there any herbs that you, I guess number one, two-part question, what are your favorite herbs to cook with? And then B, are there any herbs you shouldn't cook with?
You mean like make a meal out of? Like if I was
Yeah, like
making,
make them put, like you said, pesto with the nettles or, you
yeah.
know.
I use, so I like sauces and I like
Yeah,
pestos. So I
yeah.
use dandelion leaf, cilantro leaf, parsley leaf, nettle leaf in pestos. I think that's a great way to bump up the nutrient profile of your meals.
Might be a good way to sneak some vegetables in for kids
Yes,
too.
yes, definitely. You can sneak it in a smoothie.
Yes.
Cilantro is great for heavy metal detox also. I mean, you know,
Okay, yeah.
things can really add up on regular use. Now,
And on that
obviously,
question on the EMFs, I feel like the heavy metals and EMFs are kind of on the same energetic plane. So it's possible, I don't know in terms of research, but you know, could that help to detox EMFs as well?
yeah, that's what I was
Yes.
thinking too. When you said that, I was like, oh, I wonder if cilantro would work for
Yeah,
that.
yeah, heavy metals, yeah.
I almost think I'd work
Yeah.
more on auric protection, like
Mm-hmm.
energetic field protection. Holy basil
Right.
is great for that,
Okay.
and flower essences in general are really good for that. So I can look up some flower essences and talk to you about that. Yarrow is one that comes to mind. Yarrow
Great.
flower
Okay.
essence.
Thank you. Another thing that we kind of have in integrative medicine is about, you know, doing a lot of vitamins, sometimes multivitamins or zinc or vitamin C. And, you know, there's some, I've been reading on how, you know, should we, and I don't mean to open a can of worms for everyone that's listening on here, we're saying to take daily vitamins, but, you know, there's an antioxidant response system or ARE in the body. And so, you know, there's a question of whether or not taking the same thing every day, is that suppressing that ARE system? And so should we take things more, you know, on an intermittent basis at times? And some things are long-term, like you said, I think for that one case, but, you know, is intermittent better in terms of a more of a hormetic effect?
I like seasonal. So, and
Seasonal, yeah, yeah.
seasonal and constitutional.
Okay, that makes
So,
sense. Yeah,
separate from an issue you're trying to support, right? So if
right.
you have, so if you're supporting the issue, yes, of course, you have to have a high
Long-term,
dose
yep,
consistently for a
yep.
certain period of time,
That
however,
makes
their
sense.
body
That
time to
makes sense.
respond.
And then Christine says, Colleen makes awesome herbal infused goodie balls. Herbsmith, can we have some of those? Can you bring some?
Yeah, I almost
The
put a recipe in
CIH.
there for Christine. I have one
That's amazing.
herbal, and I'm happy to send that to you guys. I have, I love making them. Use nut
Is
butter.
it, because you know how like when you go to a restaurant, you order something, it's like, chicken with cashews versus cashews and chicken or something. Is it like nut butters with herbs, or is it herbs with?
Yes,
Either way
it's nut
sounds
butters
amazing.
with herbs. They're nut
Okay,
butters with
okay,
herbs. They're amazing. And there's a
yeah,
great way
that's
to
great.
get, especially for a deficient person who
If
needs
we can
extra
maybe
calories.
do a special order, pre-order or something,
Yeah,
be great. Thank
I'll
you.
make some and deliver them for you
No,
guys.
thank you so much. Great.
And herbal infused cakes. I mean, I don't eat sugar myself, but I use maple syrup and honey. I make a raw cacao with reishi and burdock cake.
Oh wow,
And I'll do a hawthorn, rose, and hibiscus syrup to go on top of that.
that's
So
amazing. Herbal cake. Yeah.
yeah, if you're going to indulge, I don't do it very often, but when I
It's a
do,
good
so
it's a
things
good
like that.
substitute for the COVID diet, right? The high
Yes,
sugar, high flour diet. Maybe
yes,
some high
yes.
herb diet is better for
Yeah,
this.
and antioxidants, herbs, don't underestimate the power of cooking with rosemary, oregano, garlic,
Yeah, I do
ginger,
that.
onions. All those
Definitely.
things are
Yep.
really, those are good accumulation over time, get those
Right.
sulfurs in. So
Yeah, that's great. And
good
then
turmeric.
how do you're mentioning about constitutional, how do you work with and talking with a client, let's say, or talking to someone about constitutionally what herbs might be right for them in relation to their elements in terms of acupuncture, for instance.
Have worked with an acupuncturist for years personally. I don't know. So Western is a little bit different than
I was curious because
TCM.
sometimes people go to different practitioners or people, and
Yeah, and I kind of use a mix, and I'm actually I lean more towards Ayurveda and Western. I do love
yeah.
Chinese medicine. I think it's so deep and so ancient and so true. That and Ayurveda are so, and we've
I
lost
didn't
the
mean in
Western
terms of
herbalism.
herbs, but let's say someone is dominant in terms of their like wood element. I don't know if they've kind of
Okay.
worked with you on like which herbs, on the
Yeah, so
Western side would be.
yeah, and I don't do that with Chinese medicine, but a
Yeah,
wood person might be more rigid, more dry,
right.
or issues in the liver and gallbladder. So I could work that way. So who's
Detox, got it. Okay,
some
yeah,
rigidity
that's
in the
great.
musculature, maybe. So maybe some herbs that
Hmm.
help relax that response. So as
And
opposed to
not to
some,
keep on asking a ton of questions here, but how do you work with mushrooms? Like in terms of how does the fungi kingdom interact with the plant kingdom? I guess. Yeah.
that's such an amazing kingdom, because if you think it's like the spaces between, like they're at the spaces
Right
between like the
there.
big plants, and they have such
Yeah.
a relationship with the plants, like what plants are going to be working with what trees. I do work with them. I like them in powders or decoctions. That's my preference, but most people aren't going to do that. So most important thing is compliance.
Hmm.
So what is going to help the client be most compliant? And so reishi, if a person is into making decoctions, I'll teach them how to make a reishi decoction, or they just use a tincture. Is that what you mean? Does that answer your
I think
question?
so, yeah. And you answered Monica's question already, I think, right? About where to study herbalism.
Oh, no, I didn't. So I didn't see that one. I'm sorry. So
She said, yeah, if I want to study herbalism, where do you recommend studying? That's the
you can
setup
study where
question,
I
I think.
teach.
Yeah,
It
teach
depends on where
herbalism.
you want to go. So I
Yeah,
teach at the Mid-Atlantic School of Herbalism. If you go on Smile Herb Shops, Smile
yeah.
Herb Shops
Maybe Jen, you
website.
could type in something in the
Yeah,
chat
I
box
can
on
do it
that.
here.
That's
Sorry.
okay. Okay.
So
And
let's
then you
see.
also see clients for herbal
I
medicine, I
do. I
guess,
see
or
clients privately,
okay,
and I'm doing that via Zoom right now.
okay. Do you have maybe you could type in your website then for everyone
I
listening
don't
on
have a
that.
website yet.
Or whatever you do for
Let's
your
see.
phone number or something, if you want. I mean, it's
Can I
to-
spell here?
totally, that's great. Thank you. Email. Okay, Christine said an email would be good.
Yeah, just contact me about the herb school. It's a modular format, 1 week in a month. We're completely online this year. We had to change. We were in person, which of course you want to learn herbs in person. You want to be walking outside, looking at herbs and tasting
Yeah,
herbs and smelling them. So it's a bummer we're online, but we got to still get the knowledge out there
yeah.
and
We
get
got
the
to
more.
upgrade our computers and get to that
Yeah.
2.0 herb where you can smell it in the computer.
Yeah, that's right. That's right. We
So
do
I
herb
have
walks.
a question that's a little self-serving since I'm doing a webinar on a group visit on sleep in a couple of weeks. I'll give you credit for it. What are your favorite herbs for sleep in general?
So it depends on what's going on with the sleep. And of course, dosing matters, and it's when you start dosing. Okay. So, and what kind of things this person's having. So if a
Hmm.
person has a lot of circular thinking, they can't calm down, I would recommend skullcap or passion
Yeah.
flower. If they
Okay.
have a lot of muscular tension, Scutellaria lateriflora. muscular tension, Scutellaria latiflora, chamomile, and wood betony. Those are good for sleep.
Wood
So,
betony, okay.
yeah, wood betony. Stachy's, the Stachy's,
A lot of those are hitting the GABA
Stachylaris.
receptor. Yeah, a lot of
Pardon
those are
me?
hitting the GABA. They're hitting the GABA receptor. A lot
They
of them.
do.
Yeah.
They do. Reishi's great. So you want to keep them calm. You want to keep them in parasympathetic nervous system throughout the day. So you can do nourishing infusion teas throughout the day of the skullcap, chamomile, passion flower. Lemon balm is an uplifting nervine. And so you want to keep them in that mode. So you do that during the day, and then you do higher doses at night, an hour or two before bed.
I love lemon balm. Lemon balm tea, sleep so great with that. It's so good.
It's amazing. It's amazing.
Yes.
So those are just a few. Lemon
Great,
verbena,
thank you.
blue vervain.
Okay, and then I think we have time for one more. And then Angela, hey Angela, good to see you here. Angela asks, what sources or stores do you recommend for purchasing herbal supplements? Any particular brands? I'm also curious if you know of either you or yourself that either make their own tinctures. I'm not sure if you do that or not, but.
So I do make my tinctures, but I only make a small amount. I buy them wholesale from Herbalist and Alchemist. As a practitioner, I can do that. And
Oh,
then
I see. Okay.
I custom formulate for my clients from that.
Got it. Okay.
But there are some people who, as a layperson to buy herbs, I love Gaia herbs. They're still run by Herbalist. Solar Ray, I like older, these are capsules. Tinctures, I love Herb Farm.
Gaia.
Yeah, I love Gaia.
Yeah,
Tinctures,
Herb
I love
Farm.
Herb Farm, and I love Herbalist and Alchemist. Corey Pine is an herbalist in Tennessee, I believe. He's a much smaller herbalist, but he makes amazing tinctures. Jared Urchek is an acupuncturist in College Park, but
you know what? He was on here one time. He was on here.
He makes great reishi and mushroom. He is a mycologist, so he makes great mushroom tinctures, and he actually just has a huge harvest of milky oat he told me about. So they're not reliable, just as he gets them.
From a very broad-based sort of just going to the grocery store, Gaia Herbs is really nice because it's very accessible, and they grow the herbs in Asheville, I think, and you can actually source when they grew them and stuff like that.
Yeah, and Gaia and Solar Ray is great too. But if you want bulk herbs, you can go to Smile Herb Shop or Frontier Co-op or Mountain Rose Herbs. You can get bulk large amounts. You can make your own tinctures. I encourage people to make their own medicine. You can make your own tinctures and decoctions by buying the herbs in bulk. So,
yeah, you probably want some maybe like a virtual demo on that or something, how to do that.
I'm happy to do that. We can just do the folk method. That's not a lot of measuring, and we can just do simple tinctures that way.
That would be great to have you on for that too. And yeah, so Colleen, I think if there's any more questions, we'll end today. Would love to have you back again. So thank you so much, Colleen, for coming on again for round 2.
Thanks for having
Margaret,
me.
yes, very welcome. Margaret did also second the Oregon Wild Harvest. Yeah.
Yes, I love Oregon Wild Harvest. And thank you for bringing that up, Margaret, because that's another company I absolutely love.
Yeah. So we will see you next week with Elizabeth Reese for Heart Math. And until then, have a great weekend, everyone, and see you soon.
Bye. Thank you. Thanks for having me.
Thanks. Sure. Thanks, Colleen.